This is Wade Griffith inserting an NG tube for nursing 219. So I'm going to go ahead do my GPSPs, 11 med rights, 3 med administration checks. So I've already secured my site. My table's clean. I've already got my tape hung. So I'm going to go ahead, come in, introduce myself to the patient, get their 2 patient identifiers, check the wristband to confirm those. Tell them I'm going to be giving them an NG tube. I'm going to ask them if that's okay. They say it's fine. They can't breathe through their right nostril, so I'll be putting it through the left. I'm going to go ahead and some hand hygiene. I'm going to measure my tube. Alright, so nose tip to the earlobe, measure that, then hold it, find the xiphoid process, measure against that, hold it right here, get my marker, and mark right there. I'm going to sit this right back on top of the packaging. So I've done that. I'm going to do hand hygiene, and I'm going to put gloves on. On the large gloves, unfortunately. Alright, so I'm gonna go ahead now, put my lube on this. Alright, so it's gonna go in the right nostril. Left nostril, I mean to say. Alright, so have his head back and top at the pharynx, which I have. Now I'm gonna have them put their head forward and they're gonna swallow. So swallow, swallow, push, swallow, swallow, swallow. Got it in there all the way. I'm now gonna go ahead and secure it. So get my tape. And also, I didn't see any process or any sign that they weren't taking it well. If they were, I would have just discontinued it immediately. So, secured that. I'm going to come and get rad, and they're going to come in and verify placement. So now that I've done that, and it is verified, I'm going to go ahead and take this out. This, I'm going to remove some gastric contents to check the pH. Alright, so I'm going to put it on my pH strip, which I have right here. And that was a 5, so that's good. I'll put that back in before I need to put it connected to suction. Alright, so I've done all of that. I'm going to go ahead now and actually secure it. My other tape.
I'm not sure. I had planned on going home and looking at all that.
Don't want that. Tape's really hard to manipulate in gloves. I'm just going to go ahead and put the back of this glove. Alright, so it's still secured. I'm going to go ahead and grab it and take this piece off, toss it in the trash. Take that down. So if I had large gloves, I probably could have done this a little bit easier, but you see what I'm trying to do. Go ahead and wrap that around on that side, and then go ahead and wrap it around right here. Alright, so that's secured. Now what I'm going to do is I'm going to go ahead and think for a second. I'm going to measure it.
might get confused.
Alright, so I'm gonna go right from the nostril to the end of the tube, like so. And I got 50 centimeters, so that's fine. You can put that up. And now I'm gonna go ahead and connect them to suction. I'm gonna secure this with a piece of tape
I ate too much food, I need to go home.
right above the stomach,
Set my coma set up.
and then we're gonna go ahead and connect to suction. Alright, so I'm gonna come back in a minute just to make sure they're still tolerating it well, and that it's flowing properly. I'm gonna go ahead and document it, and that's gonna be it. Thank you.